bear with us. Please let us know if it's not working, so we can just pause and figure out if anything is happening that we can fix. But we are interesting times right now. Hope you guys are staying sane and healthy at home. The governor just gave us a stay-at-home order today, so that will be another interesting change in our lives. Luckily, diaper store is an essential business, so we get to keep running. And it's the perfect time to stay home and potty train. So I'm going to introduce Mara, who is our toddler potty training instructor. And my favorite thing about Mara is that when in her interview, she said her favorite thing about being a preschool teacher was toddler potty training. So she has a lot of experience in this field and has a lot of good things to say. So Mara, take it away.
Thank you, Carrie. Like Carrie said, we might hit some bumps. We'll work them out in real time as best we can. My name is Mara. I was a preschool teacher for 5 years. I worked almost exclusively with 2-year-olds, so I did a lot of potty training. I potty trained probably somewhere upwards of 30 to 40 18-month to 24-month-year-olds. 30-month-year-olds. I also excuse my words, as this is a new format for us, and it's interesting because we don't get the same kind of interaction as we would get in a live class. So if I stumble over my words, please give me some grace. We're going to get going. I question Carrie, changing the slides.
Mm-hmm.
What's the best way for me to do that? Can I change it from this format? Or do I go over?
Yeah, it'll share your screen as you're changing it.
Okay, so I want to stay in this. All right. So here's a look at our agenda for the evening. We already did introductions. We're going to talk a little bit about what this experience looks like through your kiddo's eyes. Talk about your mindset going into this task, into this challenge. We're going to switch from thinking of this as something that a child needs to be ready for, and instead think about it as something that they are capable of. Then we're going to get into a how-to, looking at how to, step-by-step kind of guidelines for how to accomplish this task. And then we'll open up some time for questions. As we go through this, you may have questions that come up just naturally. Please feel free to IM us, and we will... Carrie will relay them to me, and I will do my best to respond in real time to your questions. Are we looking good on? Great. So let's take a minute to think about what this experience looks like for your kiddos. Like Carrie said, this is an ideal time to be taking on something like potty training. You're already home, someone is home with young kids for huge chunks of time. We're going to be home with them, especially after today. We're going to be home with kiddos all day, every day. It's a perfect time to be taking something like this on. So let's take a minute to think about what your little one's world looks like right now. They might have a sense of some things being a little bit different, but also they're probably really excited about the fact that mom or dad or some other close caregiver is going to be with them all the time. They also have lots of different things going on in terms of their own curiosities in the world. They are excited about getting to spend this time and having play, and want to explore and want to try new things. They have also never experienced anything other than diapers for the most part, unless you've done some kind of something else earlier in their lives. They only know the sensation of diapers. So unless you've done something, the term I was trying to come up with is elimination communication. If you've done something like that, they might know something different. But other than that, they're actually really familiar with the feeling of diapers on their body. It might feel weird to us that trying to think of that squishy, wet feeling as being something that would be familiar and known, but for them it is. They're also completely used to the caregivers in their world doing the work for them. up until this point, for the most part, this is taking care of toileting needs, of diapering needs, of those bodily functions, has been something that the adults manage, and that isn't their job. As a result of all of these things, they're about to step into the unknown. It's a totally new experience for them, which might at times feel a little bit scary, and that's when you might start to get some of the pushback, but also can be really exciting. We're tapping into some of that beautiful natural curiosity of young kids in this experience. Your mindset is maybe the biggest chunk of this. One thing I want to hit home, that this class, the idea behind this class, is to give you the best possible information going into this challenge. However, it will always be at times more difficult than we make it out to be. This is a truly challenging thing and will test you. It will be a testing, trying period of time, especially in those early days. And it's not something to be taken lightly. It is something that you can do. You are capable of it, and your kid is capable of it. And a huge part of it is the mindset that you go into it with. So the first and maybe most important question is, are you ready? It's not necessarily about your kid's readiness, it's about your readiness, your preparedness for taking on this task. I want to hit home again that this is a big moment. It can be a really exciting moment. One of the reasons Carrie mentioned that I loved, as a preschool teacher, I loved potty training young children, and the main reason was that I see it as one of the things that we as people go through and have to step up in a way that we haven't had to before, and have to actually figure something out on our own. And to see a young person have that moment of pride and of a sense of like independence and autonomy over their bodies, and realizing like, oh, I can take on this challenge, I can figure this out, and it's a beautiful experience that you get to be a part of, and can be a really, really incredible time for learning and bonding with your child. Also, a lot of opportunities for conflict, but the flip side of that is you get to spend a lot of time together, which is and are paying very close attention to one another, which always makes a beautiful space for learning and bonding. The number one thing that I would consider brings about success in this process is consistency. And I'm talking consistency when it comes to the language that you use, both with your child and with other caregivers, the way that this challenge is framed, the messaging around it, whether it's built up to be something big or whether it's something that's just frank and is a change that's going to happen. That kind of messaging really does matter. And your commitment to getting this done. A lot of times it does get hard, it does get difficult, but it doesn't mean that those are times to stop or reel back or give up. It takes commitment even through the hard times, and that's how you get there. All right, so a very common term in child development broadly, and especially when we're looking at something like potty training, is the term readiness. We're going to try to scrap that word and think instead about capability, and I'll explain why. A common question, or a common kind of wondering for caregivers with young children is, should I wait until my child decides to use the toilet? There's a couple issues with this question. First off, that's a really complex decision for a young child to make. Especially, we talked a little bit earlier about the way that a young child would approach something like this. This is something totally novel to them, totally new, unknown. Using a toilet is something that they've maybe never done before, and a diaper is something that they have experienced probably their whole lives every day. So there's the very familiar, there's the totally new. That kind of complex decision making it's not developmentally appropriate. It's not necessarily about respect for a child's choice. It's respecting where their brain is developmentally, and that's asking too much. Asking them to make that kind of choice is asking too much. You also might pass what we refer to as the window of opportunity, which we'll get to in a minute. It's referring to kind of the ideal time developmentally for a child to take on this task. Instead, we want to shift to thinking about what a child is capable of. And we're going to give a sense of what are some of the indicators of capability. One of the main reasons that we really appreciate the shift towards capability is thinking about children as whole beings, whole people who are capable of taking on challenges. It's a sign of respect. It's a sign of respect of what they are able to do, as opposed to us determining when they are ready or not. It's recognizing their abilities. So let's dig into this term window of opportunity. When we're talking about potty training, the ideal window is between 18 and 30 months. There's a few reasons why. A big one, so I know 2-year-olds very well, and a huge part of this period of time developmentally is that internal drive to please, in particular, the caregivers around them, and other trusted adults in their world. Young children at this age, especially right around 2, are really craving independence as well. They want to copy what the adults are doing. They want to do it themselves. They want mine. They want that little independent toddler stomp that I love so much. They want to do it themselves. Also, in this period of time, in terms of the development of a young person's muscles, the muscles in the pelvis that control the control bodily functions are developing at a time in which it's ideal to train the brain to respond and control these muscles. It's right in this window of 18 to 30 months. So the question is, what if I wait longer? Or even, what if I have waited longer? Or what if my child, there's also the question of developmental delays that completely play into this idea of capability, and that might kind of extend the period of time. There's just a couple things to take into consideration. Right around 3 years, for most children, you'll start to see the development of free will, which is a beautiful thing. It's so exciting to see young people making decisions for themselves and exercising that independence on kind of a new level. However, for something like supporting them through making a change, like switching from diapers to using a toilet, free will can be very frustrating for everyone and can kind of get in the way of their learning in this area. You get the kind of resistance that isn't helpful for learning. It's the kind of resistance that might just kind of lead to backsliding. There's also an increased risk of socialization and shame that comes from socialization. So as children get older and start to become more social beings, especially if they're in a setting like preschool or daycare, there's a greater risk, or a greater, it needs to be taken into consideration that there may be some negative stigma or shame that comes associated with that socialization. It also can just be a more difficult process for everyone, including you. I think one of the things that I witnessed often when I was a preschool teacher is seeing families not realize that diapers are easy at some stages. Diapers feel like the easiest strategy. But as your kid gets bigger, what comes out of them gets bigger as well. And at a certain point, a diaper can't hold it anymore. And you have a 2.5 or 3-year-old who is making poops that are the size of adult poops, and they don't fit in a diaper anymore. And it creates huge messes. It can be a very difficult process for everyone. So let's take a minute to think about what we're actually talking about when we say capability, or when we're looking at a child being capable. This isn't necessarily a a perfect list. It's our best kind of guidance for you. The number one piece of guidance that we can give you is that you know your kid best. You're going to be the best at reading these signs and knowing what they're capable of. A handful of common signals that we will talk about. The number one indicator here is interest. Interest in using the toilet, interest in talking about the toilet, interest in how it works, in going in there with a parent and trying it out, wanting to sit on it. Any kind of interest is a huge signal that a child is capable of taking on his task. Another is any kind of communicating needs. Now this can be through nonverbal communication, like sign. It can be through verbal communication, which includes, in either of those categories, includes a calm and clear ask for something, like I need some milk, or it can be a tantrum. Either way, throwing the body on the ground, demanding something, demanding that a need be met, is also communicating need. It's showing that ability to recognize a need and communicate it to somebody else. That's another sign of capability. Another is asking to be changed. That's a sign that this child is able to register the sensation in this portion of their body and make a connection to what is going on, what that physiological process is. The next one of my all-time favorites, is hiding to poop. In my old classroom, my most recent classroom, we had a poop spot. And I don't know how this was communicated. It might have just not entirely been communicated within the class. But everyone, at one point or another, right around the time when they were capable of taking on potty training, would start to poop in our tiny library. They would hide behind our bookshelf, the little bookshelf that went up to here. They would hide behind the bookshelf, and then you could see them back there making their faces. And we knew, oh, so-and-so's going poop. But they wanted that privacy for that process. They were starting to register that this was something that was that felt private to them. The last one we'll note is staying dry for 2+ hours. Again, that's a sign that the muscles down here are starting to develop and are capable of taking on this task. I'll pause for just a minute to check in to see if we have any questions. I'll hold for just a second. We sometimes have a little bit of a delay on our feed. I'll just check in with Carrie. How are we looking?
You see the question?
All right, we're going to get back to it. Carrie's going to let me know if any questions come up that need urgent attention. But we're going to jump into our step-by-step guide. As I mentioned earlier, take this as a guide. It's this is one of those challenges that will present differently for everyone, and will be more difficult than we portray. This is a good step-by-step guide to follow. Just remember that when it comes to reality, the reality may feel may have different feeling once you're in it. So this is the general timeline that we're going to break this down on. The first stage is planning. Then we'll look specifically at day 1. We'll look at week 1. We'll expand that frame a little bit, the time frame a little bit, and then look at month 1. First, looking at planning. The first thing we would advise you consider is picking a time that works. We're in that time. We're the great time to start because everyone is already home. The ideal here is being able to clear 1 to 3 days minimum. Luckily, we all have a lot of time cleared now. And what we mean by clear is cleared completely. No other commitments, because during that time, your kiddo is the sole focus of your attention, because your job is going to be running them to the toilet and watching for that sign of when it's coming. The next thing we would urge you to consider is communication. So that would be communicating with any preschools, daycares, grandparents, aunties, nannies, other caregivers in your child's world that you are about to make this change. From the preschool teacher perspective, it was really difficult to have this kind of challenge thrown on you in the moment. There were a couple of times where I had families who came in on a Monday morning. They said, "Hey, we started potty training over the weekend. They're sort of figuring it out, sort of not really. Here we go." And it's stressful both for the other caregivers, and it's also stressful for that child because not all the caregivers are on the same page, and it can make it very difficult for them because then they don't have clear boundaries, they don't have clear expectations, and that can lead to frustration and regression for them, which we don't want. Also, communicate this upcoming change with your child. We recommend about 1 week ahead of when you're going to make this change, and that you just state this in a very casual, very clear, matter-of-fact way. For example, just saying, "Hey, so-and-so, in a week, we're going to throw out your diapers and pee and poop are going to go in the potty. No more diapers." It doesn't have to be a lot of fanfare. It also doesn't have to be morose. It doesn't have to be a sad transition. Just casual and matter-of-fact. It's just a change that's coming, and we're all going to do it together. Next, we would push you to consider clothing. Clothing is going to be important in this process. The easier a child can move their own clothing, the better. So practice now. Have your kid practice taking off especially their pants. A good trick is using the belt loops in the front. If they're wearing pants with belt loops, this is a great way for young kids to pull down and pull up. We recommend using easy clothes, so clothes that don't have snaps, don't have buttons. The things that you would have to assist with are going to get in the way and make it a more frustrating process for you, yes, but more so for your kiddo, because they're going to be wanting to do it on their own, and it's going to be a barrier for them that doesn't need to be there. You may need to help them with clothes throughout this process, and that's fine. It's just going to be easier for them and for you if they're able to manipulate their clothing more independently. The last thing we'll point out that is something important to consider in this planning stage is getting a portable potty. We actually recommend getting two. One for the house and one for any kind of travel, which again might be different right now. Any kind of travel, because you don't know when your kiddo's going to need to go, and you might be in the car on the way to somewhere. And if they need to go, they need to go. So having one of those little portable potties, like this one right behind me, I hope you can see, might be, what? You don't think so? Having one of these portable potties could really save your day in that moment. It can save you from cleaning up a pretty nasty car mess. We recommend putting away the potty until your child is ready. We don't recommend using it as a toy, having Stuffy sit on it, having it be something that's played in, for a couple of reasons. Number one, there's something that I like to refer to as kind of the toddler magic, that when something is special and used for one distinct purpose, it has kind of a magical element to it from the toddler's perspective. We want to try to preserve that as much as possible with this potty. The potty is just for potty, and it's an exciting thing. Also, we want it to be a part of, for it to carry some kind of importance and significance as something that they use to take care of themselves. It's a part of this learning process. It's not a toy. All right, we're going to shift to looking at day one. We have day one distinct because day one is kind of a big deal. It's jumping into this change for you, for your kid, for other caregivers. It's a big change for everyone, and it deserves extra attention. The goals of day one are that by the end of the day, and I'll note that when we say day one, you'll notice we said day 1 to 3 days. So it might look a little bit different for different families, different kiddos, just depending on how easy this process is for you. So by the end of day one, this day one period, your child learns the feeling of pee and poop leaving the body, what that feels like. And they also understand that pee and poop go in the potty. Those are the only goals of this first stage, this day one phase. You'll notice at the bottom corner we have a picture of M&Ms and a picture of stickers with big X's through them. You will see in a lot of potty training curriculum and potty training books and in advice shared between families that things like M&Ms or Skittles or stickers are a great way to reward use of the potty. We don't recommend this. There's 2 big reasons why. The first one is that it takes away from what this experience is. That this experience is supposed to be something that is motivated and kind of driven by taking care of yourself and learning about yourself. And also, I have personally experienced many families go through the use of these kinds of tools, these kinds of reinforcing tools, and not know how to stop, and it leading to actual negative outcomes for these families, because they get a little bit stuck in a system of there's an M&M for every time young kiddo goes pee, and there's 3 M&Ms for every time they go poop. But how do you stop that? And how do you stop that without leading to conflict and without leading to regression, where it becomes, okay, I'm not going to go potty until I get X. I have seen these systems lead to great initial success in the first couple days, and then a lot of turmoil and potential regression in the future. So in general, we don't recommend any kind of external motivation like candy or stickers. Taking a look at what you're actually doing on day one. Number 1, you're throwing out all diapers. Now we have a little asterisk on this, and that is because you may choose to save some diapers for night and naps. We'll talk about that a little bit later. We'll talk about nighttime. But we recommend changing what these are. You might change to a different brand. You might get a different kind, different color, and give them a different name. These are night pants. These are your sleep undies. They're something different. They're not diapers anymore because diapers are gone, but these are something different that we only use for nap at night. In this day one period, you are staying at home all the time. We advise that your kid is not wearing any clothes, so that you can see when they're going and so that they can see when they're going, because one of our goals here is that they're learning the feeling of pee and poop leaving the body, so it's important for them to actually be able to see it. Your number 1 task is going to be to watch them, and the second they start, you get them to the potty as fast as you can. Over the course of this day, that period of time between when they start and when you get them to the potty or when they have that kind of, when you pick up that they're about to go, and when you get them to the toilet, should get longer and longer. They should be able to hold it longer and longer and longer over the period of that time, over the period of this day. And you would just clearly and casually affirm that pee and poop go in the toilet now. A couple of tips and reminders for this day. Remember that this is a great opportunity to bond and learn together with your child. You get to spend, we're right now fortunate enough to get a lot of this time, but it's actually pretty rare in typical times to have so much one-on-one dedicated time with the young people in our lives, and it's a beautiful thing. We do recommend upping their fluid intake just slightly. Doesn't have to be a lot, but just a little bit more water, a little bit more milk coming in will give them more practice. There will be more coming out. You will 100% be cleaning up all day. So might be worthwhile considering what you have out in your house. Are you comfortable having those things have pee on them? So if there are certain things you want to put away for this period of time, that would be a good idea. We also recommend that you enlist your child in the process of cleaning up. You've got the time anyway, and it's a good time to affirm that now pee and poop go in the potty, so let's just clean this up. Doesn't need to be something that is shameful or they did something wrong. It's just, oh, okay, we're going to clean this up, and pee and poop go in the potty now. We also recommend getting books and other attention-occupying items for toilet time, and to have these being kind of special items that are maybe kept near the toilet. Bonus if the books are about potty training and about using the toilet. You can get some of those books ahead of time, and in other times you could get them from the library. There's great book bags, potty training book bags. But these will help when your kiddo is sitting on the toilet, help them sit and be able to extend that time on the toilet as much as possible. Because we all know, around 2, you're real wiggly. Real wiggly. Alright, we're going to take a look at week 1. For week 1, goals are a little bit different. The goal is that your kiddo is wearing clothes and can use the potty in multiple locations, so we're talking outside of the house. Your tasks here: clothes are on, underwear is not recommended. This is, we recommend clothes on, but not underwear. Underwear is a little bit, sensation-wise, the way it feels in the body is a little bit too similar to diapers. And for your kids learning, their brain can kind of be tricked into that old pattern where that kind of tight feeling on their body is a diaper. I just go whenever I need to. So eliminating that as a possibility is kind of the best way to go here. You also begin what we call prompting. So here, an example that we have up here is, it looks like you need to go pee. There's the potty. It's not necessarily a directive, like a you need to go right now. It's kind of a gentle or firm reminder. It looks like you need to go. There's the potty. You're also going to begin outings. Now, this is kind of a tricky thing to think about in this time.
Mara,
Yep.
we're going to pause for a question.
Okay.
My
We're
son
pausing
is
for a
2 years
question.
old. Should we train him to pee standing up right away or pee in the potty pot?
So the question was, my son is 2 years old. Should we train him to pee standing up or pee on the potty pot? That's a great question. I've seen families do it, and I have helped young kiddos do it a couple of different ways. I think to a certain extent it depends on how easily your kid can get to a potty. If they are able at 2, if they have a step stool, they can get up on a big toilet and be safe while standing up. Maybe that's a good way to go. Any system that relies on adults having to assist the child, there's going to be some barriers down the line when they're trying to do it more independently and with less assistance, and potentially like very independently. It will get a little bit tricky if, for example, they're not able to get to toilet height on their own, if that requires some adult assistance. So a couple things to think about. I haven't seen really any issues with a young kiddo going from using like one of these potties to then standing later. I haven't seen that be an issue or a barrier. I think there are a couple fun ways of using the big toilet. One of my favorites is the race car, where instead of sitting on the toilet facing forward, as most adults do, the kiddo is sitting facing backwards and holding onto the back of the toilet, which allows them to lean over a little bit. I hope that answers the question, but if you have any more questions, feel free to IM, and I will get back to it. Oh, I'm getting a thumbs up. Thank you for the question. That was a great one. So I was talking about outings, which again, the caveat here is that outings are a little bit trickier in this period of time because we're limited in the kind of outings that we can go on safely. But we still can go on walks, so there is that. We would recommend starting with small outings, and then transition to longer ones. A few tips and reminders for this period of time. This is the period of time where you're probably going to get the most resistance, or we're going to start to see the resistance get big. One of the main reasons for that is what we call over-prompting. Nobody likes being bugged about things repeatedly, including our little ones. So a constant, hey, do you need to go? It looks like you need to go. There's the potty. Can start to bug, and that's when you might start to get more resistance. So choose wisely the time when you overprompt. Use that tool well. Also prepare well for outings. So when you go to a new location, give a little guided tour of the bathroom. So it's familiar, so it's a known place, and when the time comes, that your kiddo already knows where to go and what to do. We also recommend bringing a portable potty wherever you go in this period of time, because you never know when that moment is going to strike. We recommend bringing extra clothes and towels. You can transition your diaper bag into a potty training bag. Wipes are still helpful, and any kind of cleanup tools, including if you use a service like Diaper Stork, having your old rags are a great cleanup tool in this period of time. We also highly recommend you celebrate, especially getting past day one alone is huge reason for celebration. We recommend celebrating on your own, celebrate with your kids. It's cause for celebration. It's an exciting time. Again, prepare for resistance. It will come, and like we said, the resistance at times might make you want to change course, might make you want to turn back. Don't. You're all capable of doing this. You're capable of taking this on. Also remember that in this situation, in this learning process, hearing a no isn't always resistance. So in going back to that prompting situation where you say, it looks like you need to go potty, or it looks like you need to go pee, there's the potty. If your kiddo says, no, I don't, they might actually not have to go. It might not be an act of resistance. It might actually just be them learning that they don't actually have to go in this moment. All right, we're going to take a look at month 1. The goals for month 1, again, shift a little bit. By the end of month 1, you're hoping that your child is using the toilet consistently without prompting, so without you giving that encouragement to use the toilet. What you're actually doing here, you're going to continue prompting until it's no longer needed. You're doing kind of a gradual tapering off. And a lot of that is you learning about your kiddo and seeing how they're taking this on and adjusting as needed. You're also going to reintroduce underwear, which is usually a pretty exciting thing. Underwear is so cool now. There's glow in the dark. There's any character on any show or movie that you could ever want. There's all different kinds. And it's usually a pretty exciting moment to get to join the underwear club. Again, another time to celebrate. You want to expect accidents to taper off over the course of this month. So what would be okay in this period of time is 3 to 4 accidents a week. Totally normal, totally expected. If you're getting 1 to 2 accidents a day, that's not okay. That's a sign that somewhere along the line something wasn't learned, likely back in the very, very early stages, that day one phase, likely there wasn't, there's a missing piece or something needs to be strengthened, in particular with that kiddo's understanding of what's going on for their body and registering that and developing a concept of what's going on and then responding. So if that's the case, if you're seeing, this is a pretty good indicator, if you're seeing 1 to 2 accidents a day, what we recommend is taking a step back, not stopping, but going back to day one, relearning some of those early skills, and then carrying those forward to a more successful month 1 outcome. A few tips and reminders for month 1. Number 1, stay consistent. Again and again, stay consistent. Your consistency in this process is going to be huge. It's going to lead to success in this. Also, expect and respect your kids' desire for privacy. Over the course of this process, they will at some point want to go to the bathroom by themselves, do it themselves, have the door shut. Expect that to happen and also respect it because they're developing their independence there. Expect power struggles to come up, and hold your firm boundaries. Hold your firm boundaries in the language you use, in your messaging, in your expectations, and make sure those are clear and communicated with all of the caregivers in their world. One way that you can kind of mitigate and come back at these power struggles is by offering choices that are appropriate for your child developmentally. So an example, we're leaving the house, and before we leave the house, because we don't know when we'll be somewhere with a bathroom again, we're all going to go potty. So do you want to go potty before me or after me? You're offering a choice. They can go before you or after you, but your boundary is clear. Before we leave the house, everyone's going to at least try. But there's some choice in there which allows a degree of control for your kid, which is one way to kind of make those power struggles, or to avoid or make the power struggles go a little bit easier. We're going to take a second. I think Carrie has a question before we dig into naps at nights.
The question is, we purchased a my-size potty and just started really using it. I find that my son gets fixated on the flushing mechanism. In terms of the type of potty at this stage, is simple more ideal?
So, that's a good question. And I'm not entirely sure. I think that simple, I don't know that it matters one way or the other. I think it might matter more the boundaries that are set around the way that it's used. In the preschool, we had a whole small array of toddler-sized potties that were fully functioning, that everybody used, and there were times at which these became the place where the boat goes, or the place where my trash goes, or the place where my hands go, and we had conversations usually with the whole class around what the toilet's used for, and conversations also about water use and that's something to be preserved and that we use it only when we need to and it's not a toy. Simple might be easier for you if it's feeling difficult to hold those boundaries right now, especially if it's already kind of become a source of fascination. But I think the boundaries and the limitations that are set are really key there. I hope that answered your question. If you have a follow-up or comment, please, I am Carrie and I'll come back to it. Taking a look at naps and nights. This will look different for everyone, and the advice is a little bit mixed on this one. So we'll kind of give it, we have two kind of routes that could be ideal, and it kind of depends on what's best for you and your kid in this situation. One route you can take is doing nighttime training at the same time as daytime training. Another approach is delaying it a little bit and just tackling daytime. We don't recommend delaying it any more than 3 to 6 months after you start daytime. A few recommended strategies. Again, there isn't a great kind of step by step. This will look a little bit different for everyone. But a few recommended strategies we have are limiting fluid intake before naps and night. The less that goes in, the less will come out. We also recommend not for naps, but at nighttime, waking up your kid and taking them to the toilet. Usually about an hour to hour and a half after they fall asleep, they will need to go. Their bladder will be pretty full by then. Just not fully, they don't need to be fully awake, but helping them get to the toilet, go pee, get back to bed. A lot of families sometimes worry that, oh, they'll wake up and it'll be an issue getting them back to sleep. I've done this many times. I know many families who have done this, and it's usually a pretty groggy sleep state, and they go right back to sleep. We also recommend that during this period of night training that kids are bare-bottomed with a mattress protector or something else protecting their bedding, so that they get they can feel when something comes out. It helps the physiological that development, the understanding of what's going on with their body, and making the connections in their brain. We also recommend, if you have a portable potty, have it near the bed. There's no reason it needs to be all the way in the bathroom. It can be right by their bed, which then cuts down the time if they wake up and realize that they have to go. They just have to get 2 feet away as opposed to down the hall around the corner. Makes it a whole lot easier for them. With that, we have come to the end of our presentation, and we're going to take any final questions. We'll be here for a few minutes, so please feel free to write in, and I will respond to as many as I can. Keep going.
You can come this way.
Oh, question.
So.
Did you get the link?
I'm gonna go say something. Oh, you need to say about the group.
Yeah.
Okay, so I can't see myself on here. It's okay. Okay. Sorry, everybody. So we are still going to wait for your questions a little bit right now, but I wanted to bring up a couple things. So since we don't get to see you in class, we don't actually know who's attending. So we're going to ask you if you don't mind emailing us. We'll put that in the IM of what to email so we know that you've attended. We're going to ask you to fill out a small survey if you don't mind. This is something that helps us, gives us feedback, but also is required by the grant, so appreciate that. A couple other things. We would like to send you kind of our some follow-up materials, including this handout. So if we get your email, we can send that to you. We have a limited number of Oh Crap potty training books that we actually purchased to give to the libraries, and then they closed. So we're happy to rent those out to anyone who's interested. So email us if you'd like to borrow a copy. The last thing is, if you were at our class, we would have handed out some of these, which are retired used diapers that are great for cleaning up a lot of potty spills. So again, if that's something that you might be interested in grabbing, we could have those available for pickup. The last thing that we want to learn from you guys is if you're ready to start potty training pretty soon, and we are considering doing a group potty training program where Mara would be available on a schedule. So that would look like at the beginning maybe every day or every other day, and then throughout the week 1 and week 2, week 3, at least once or twice a week. And everyone would kind of start around the same time. We're looking at a day of April 4th, the weekend of April 4th to start. So if that's something that you're interested in as well, please let us know. And we'd like to get a core group, and we'd work using a Zoom meeting style, so there's a little bit more back and forth interaction. So again, thank you. That's it for me. Mara's going to come back up with any questions that come in.
So I have two great questions that just came up. The first one was, what are my thoughts on padded underwear, and does it matter what kind of underwear is introduced in that month 1? I've seen padded underwear work really well. I think that sometimes there's a danger in padded underwear being introduced as kind of an intermediary, being introduced right after diapers are taken away, which I wouldn't recommend. I would recommend delaying until that month 1 period. But I think padded underwear are perfectly fine. I don't see a huge difference between padded underwear and other underwear. I think it can be nice, number 1, for keeping things a little bit cleaner, and I have known a handful of children who are just a little bit leaky, and it can be nice for them to not have to deal with that, having to change pants more regularly. Hope that answers your question. Again, if you have a follow-up, please feel free to IM. The next question was about potty training at home or somewhere like grandma's, especially now. Some people are in different locations for an extended period of time. I think that's perfectly fine to take on something like potty training away from home, as long as that space is consistent for that first period of time, that day 1 section, and it sounds like it would also be consistent for that week 1 period of time. I think that is really the most important thing, and that it's a space where this child is already comfortable is going to be really important. I would guess that somewhere like grandma's house is somewhere where they are comfortable. Somewhere that's totally unknown might throw a little bit more, a few more wrenches in the process for you. But I think as long as the space is consistent and known and comfortable, I think it's fine to be somewhere outside of the home. Carrie, do we have any other questions coming in?
No, you did the grandma.
Yes, I did. All right. Should we go ahead and wrap up? All right. So with that, we're going to go ahead and wrap up for the night. Please fill out our survey and give us some feedback. We really appreciate it. Good luck in this endeavor, and please keep in touch. There's a couple of ways. Number 1, Carrie said, if you would like to be a part of our cohort, our potty training cohort, coming up the weekend of April 4th, and get in on this with other families, take this on with other families, and with our guidance, please reach out. You can contact us via email at ditchthediaper@diaperstork.com. You can also get in touch with us via the Facebook group Ditch the Diapers with Diaper Stork. With that, I wish you all a safe and healthy and great time with your families, and hope to hear from you soon. Thank you.